Good morning. Let's talk on quality control. Quality control is an integral part of the laboratory operations, and the purpose of quality control is to identify and rule out the errors. So, in a more precise manner, we can say the quality is defined as a conformance to the satisfying the needs of expectations of the customer. So, in the clinical laboratory, who are the customers? Customers are patient, and product is their report. So, the quality control is a process by which the entities review the quality of all the factors involved in production. Then it does consist of three components. In the reactive phase, it is the process to find and fix the flaws in the completed product with the focus on finding the problem rather than solving them. Then defect identification with the testing and inspection. The goal is to find the defect as early as possible. Then product oriented. So it entails examining, evaluating, and verifying the product or to make sure it satisfied the required standard of the quality. So the laboratory report that is pertinent to the product here, and that should be that should satisfy the patient in the form of customer, so that we can have the production of reliable report. So the quality is never accidental. It is always the result of sincere and intelligent direction and a skillful execution in order to provide a full customer satisfaction. So, if we are talking about the clinical laboratory, so it constitute only one part of the diagnostic process in the clinical practice. And what is the significance of this clinical laboratory? Because the data derived or reports derived from the laboratory, they can be useful for the biochemical investigation, and lab test is helping physician and the healthcare workers to make the diagnosis and clinical judgments. So the results obtained from the laboratory analyzers are used to diagnose, prescribe treatment, and monitor the health and progress of patient. So test result must be reliable, accurate as possible as, and these are the important for correct diagnosis of the patient. So let's talk about what are the different laboratory causes which lead to the errors. So they can be the understaff, like the if appropriate staff is not available, there is work burden. And then the equipment reliability is the second important component. It means equipments are not properly calibrated interday or intraday wise, so they may lead to the error. Then reagent should be the quality reagent, plus the reagent should not be expired, and then their proper keeping, if they are not properly kept as per the protocols instructions, so they can be the another reason to lead to the error. Then poor trained technicians, if the technicians are not qualified or not properly trained, so they may lead to erroneous results. Then workload management system is not properly flourished in the laboratory, that may also cause problem. Then poor result verification, result is not properly verified and cross verified, that may also be the reason. Then non-validated tests, and tests are applied, like tests are done via the non-validated method, they may also lead to the errors. Then time pressure and the work pressure, these are the another cause to produce laboratory errors. So laboratory result output is a very sincere and meticulous process. It is a teamwork and starts right from the patient preparation to the sample collection from the patient to the various testing procedure, recording and reporting the results. So any of the factor is not being nicely taken up, it may lead to the errors. And these errors often creep into the laboratory results. And these factors play a very important role in deciding the reliability of laboratory results. So these may be pre-analytical factors or the post-analytical factor, or they can be the analytical factors. So in the laboratory workflow, we'll see what are the various pre-analytical steps and what are the analytical steps and what are the post-analytical steps and where can be the chances of error. So the pre-analytical phase, it does starts from patient preparation followed by sample collection. So the patient should be properly prepared for the type of test to be performed, followed by sample collection. And after the collection of sample and then sample receipt, then followed by the sample transportation, and the proper accession number and registration number should be generated for a specific patient to the sample. Then in the analytical phase, there is a quality control testing depending upon the well established protocols into the literature. So, whatever test we are performing, there should not be any cut short. We have to follow the proper procedure step by step. So, there should not be any chances of error. And before quality control testing, we should have a running of control, we should have calibration of instrumentation, and then after proper statistical assessment whether the instrument is properly working or not, then only the the sample run can be performed. And followed by analytical phase, there comes the post analytical phase. So in the post analytical phase comes the record keeping. How do you interpret the results, how do you keep the results, and further there is a reporting to the patient. So these are the various phases of the laboratory workflow. And if there is any chances of error in any of the steps of the various factors in the pre-analytical, analytical, and post-analytical phase, they may lead to erroneous results. Now let's talk about the random error. What is a random error? Which varies in an unpredictable manner, magnitude, sign, and which is difficult to eliminate, but repetition can reduce the influence of random error. So like in errors in pipetting can be minimized by training, supervision, and standard operating procedures. So such type of errors are random error. Then systematic errors are those in which the course of a number of measurements of the same value of a given quality remains constant under the same conditions. For example, change in the reagent batch or modification in the testing method will lead to a systematic error. Now, what can be the effect of various pre-analytical variables on the quality of laboratory testing? We'll see in the details. So we have already discussed about what are the pre-analytical variables. So these variables are that can occur from the time when the test is ordered by the physician until the sample is ready for analysis. So in the pre-analytical stage, the most important components are right from patient preparation to sample collection and their transportation. And pre-analytical variables accounts for up to 75% of the laboratory errors. And analytical stage and the post-analytical stage depends primarily on the integrity of the specimens submitted to the laboratory, and the laboratory staff involved in the specimen collection have a direct impact on the outcome of patient lab result. So in the analytical phase, how do we know we are right? So it requires the proper standardization of the system and onto the instrument and the method which we are going to choose for sample running. Then there should be proper calibration of the instruments on which we are conducting the experiment. Then reagents, reagent should be the quality reagent. They should not be expired. They are properly kept as per the protocol. Then test conditions. All these things, all these factors have to be taken into consideration in the analytical phase. Then quality control also can be applied. The various rules of the quality control in the form of internal quality control and external quality assurance should be applied in order to identify and rule out if there are any errors. Then factor influencing the quality in the post analytical phase, that is the phase in which the record keeping is being done, and final after the final assessment of the report, it is being ready to dispatch to the patient. So the right recording and right reporting is mandatory component of this phase. Then right interpretation should also be taken into account. Range of normal should always be given for comparison to the patient's report results. Then right turnout time should be taken into concern. Then report to the right user. That is the most important component, because sometimes there can be the mismatch. The report of the one patient is by mistake generated to the another one. So that may lead to a disastrous impact in the diagnosis and treatment of the patient. So let's talk about the quality assurance and the quality control. Quality assurance is defined as an overall program that ensures that final results reported by the laboratory are correct. So while the quality control is just a component of quality assurance, this is the huge complete program, right from sample collection to the generation of reports. So whatever is steps in order to check and rule out the errors, they all come under the quality assurance. And quality control is refers to the measures that must be included during each test run to verify the test is working properly or not. So it is basically applied onto the analytical phase in order to check so if the test is properly working. So what is the aim of quality assurance? It ensures the right test is carried out, right specimen and right results, and the right interpretation is delivered to the patient, to the right person at the right time. While the aim of quality control is to ensure that results generated by the test are correct. Now let's discuss about the various terminologies used in the clinical laboratory, like accuracy, precision, specificity, sensitivity, and all. So let's first of all talk accuracy. Accuracy is what? It refers to the closeness of the result to the true value. Suppose the true value is somewhere around 100. So it is the central true value. And whatever tests we are applying in the laboratory, so this results come somewhere around away from this true value. And this is more away, and you can see the trend is here. So this result as compared to this one, this dot is quite away. This is quite beyond from the true value. So this is less accurate as compared to this one, which is very close to the actual value. So this refers to the closeness of result to the true value. If one technician performs a test on a serum which is known to contain suppose 100 milligrams per dl of glucose and obtain a result of 99 milligrams per dl. So second technician does the same test on the same sample and get the result around 93 milligrams per dl. Then the value of first technician is considered more accurate to the true value. So that is the accuracy. Then precision refers to the reproducibility of the result. If one technician performs glucose analysis on the same sample on three different occasions and obtain 100 ml and 98 and 99 milligrams per day respectively, so the results have been reproduced very well, and the precision is very good, means closeness of the test which were being performed. So here you can see it here. So actual value is here in the center, but this what this in picture it's being shown, like all the values which the technicians have taken out, all are close to each other, but they are quite away from the actual true value. So the precision is there because reproducibility of result is there. Every time the whatever result come, it is very close to each other. Initially it came 98, then 99 and 100. So these are all very close values. But there is low accuracy because they are away from the actual true value. So in this picture, we can see the low accuracy and high precision. Here in the third picture, there is a high accuracy and low precision. All these values are away from each other, but they are very close to the center red circle. So closeness to the true value is accuracy, but they are away from each other's results. That means they are not precise. Then in this picture, it shows the high accuracy and high precision. So all values are close to the true value as well as they are close to each other. So this shows that the result is accurate as well as precise. What is the specificity? Specificity is of reaction denotes that only one substance will result that particular will answer that particular test. For example, in case of glucose oxidase method, so only glucose molecules are assayed. No other than glucose can be used for this method. So specificity with respect to one particular substance to particular test. Then sensitivity, it indicates whether the method could be utilized to test a very dilute solution. For example, suppose we are doing some analysis for protein. So protein analysis के लिए we have used simple colorimetric biuret method. So it will give you the protein result some in grams. But the for a spectrophotometric method, it is useful to detect more more refined results in the form of milligrams of proteins per dl. So even if the dilute solutions we have taken, so that can be picked up by the spectrophotometry. While in the ELISA method, more smaller quantities can be picked and we can generate the result even in the micrograms quantities of the protein. So these are the four terms we discussed: precision, accuracy, specificity, and sensitivity. Now let's move on to quality assurance in detail. So quality assurance is the total components of the laboratory working in order to generate a reliable report. So there are various components of quality assurance. One is the internal quality control, and second one is the external quality control. Internal quality control done daily into the laboratory. Internal means within the laboratory, and it is applied to all the work process and every test done. And IQC procedure identify problem immediately. So internal quality control, what can be the examples, like a daily recording of temperature in refrigerator or incubator. So then repeating the test, following the standard operating procedure. So all these are the components of internal quality control program. So within the laboratory, while we are going to start with, all the equipment should be nicely calibrated before we are going to perform the test. Then daily control run should be control samples should be run first before the running of patient sample. Then a repetitive check for repetitivity and the precision of the system, accuracy of the system result. Then proper standard operating procedure should be followed while working in the laboratory. So standard operating procedure with respect to the staff, with respect to the various equipments, reagents, the proper temperature conditions, cleanliness, different and corners of the laboratory. So all these can be applied. They come under the standard operating procedure. Then advantages. What are the advantages of this internal quality control program? So mistakes can be avoided, errors can be immediately checked out and we can rule out. Then quality of test results are definitely raised. So what is control? Control is actually the analyte free matrix which is spiked with the known known concentration of target analyte and is used to document the laboratory performance on a specific analytical method. So besides the control, the reference material and calibrators will help a routine method to be correlated to the reference method when evaluated. So this material, what is control? It is the material that contains the substance being analyzed. Matrix is the same matrix which we are using in the unknown sample, which is present in the unknown sample. Then it is used to validate the reliability of the test system and run after the calibrating the instrument and run periodically during the testing process. After each run, after each patient run also we will use the new control to run in order to get if the instrument is properly working or not, because the concentration of control, we know we have knowingly spiked the known concentration in the matrix. So if it is deviating, then the instrument error can be there. So they can be random or different systematic error can be there depending upon the results of control. So running of control sample is very necessary and mandatory part of any clinical laboratory instrument. Then uh, internal quality control program depends on the use of internal quality control specimen. Then there are certain analytical ways or charts. By analyzing them, we will get to know about the errors. The errors are within the range or out of range. So the range within the deviations within the range, they can be accepted. If the deviations beyond the range, they should be rejected. So how can we make use of quality control sample in order to implement the quality control in the laboratory? So first is to obtain the control material, then run each control daily along with the patient sample. So that means before the sample analysis, patient sample analysis, we have to run the control sample first. Then run each control 20 times over 30 days, means in within 1 month at least 20 times it should be done. Then calculate the mean and 1 2 3 like 1 2 3 standard deviations within the range of that. This is the, suppose this is the main value, so we will check for standard deviation to the level of plus minus 3 standard deviations. So this is the Levy-Jennings chart. This chart is a type of a statistical process control chart which is typically used in clinical laboratories for laboratory quality control application in order to assess the quality and errors produced in the different instruments samples. So you can see we in this chart we set a mean value. Suppose for glucose we have set a value of 100. This is the mean value. And then this is beyond the mean value. These are the standard deviation +1, +2, +3 and so on. And then minus, it can be negative also. So -1, 2, 3 and so on. Then how we will record and evaluate the control values. So this is at least in order to interpret the Levy-Jennings chart, at least 20 data points we need to record for each sample. So, like on day one, this data point showing the value of 100. So day two, the same instrument, same conditions, the run has been done and the data point is towards the one standard deviation, means slightly deviating from the actual mean value. Then on day third, it is deviating beyond +1 standard deviation, that is also within range. Then in this, on the day fourth, the data point is now above the +2 standard deviation point. So this is how the run is being done, and the data points are recorded and mentioned here on this chart. Then what is the Westgold rules? It is a multi-rule quality control. Uses a combination of decisions, criteria, and control rule. Set of rules are there which can be applied onto the chart, Levy-Jennings chart, and we can approve or disapprove depending upon the pattern or trend of the graph. It allows determination of either the analytical run is in control or out of control. So if it is within control, so we can approve it. If it is out of control, so we can reject the results. Where the different Westgold rules are there, which can be applied onto the Levy-Jennings chart, and we can conclude whether the results are acceptable or not. So this is the mean value and the rule 1-2s rule. This is the first 1-2s rule, which means 1 indicates the one run, only one sample run has been made, and 2s means that is the deviation from the mean value beyond 2 standard deviation. 2s means 2 standard deviation. So it is the 2 and beyond the 2 it's going. That means there is a violation of 1-2s 2 rule. So what it interprets, one of the two controlled results fall outside the 2 standard deviation. So it alerts the technician to the possible problem, but this is not the cause for rejecting a run. There can be chances of random error which can be rectified. Then and the 2s2 rule is means two consecutive run have been made and they are showing the standard deviation beyond the 2. So you can see this is the second run, third run, 2 runs consecutively been made, and both data points are coming out of 2 standard deviation range. So it detects the systemic error and is violated when the two consecutive IQC values exceed the mean on the same side of the mean by 2 standard deviation. So it is sensitive to some systematic error. Then third is 1-3s rule. What is the 1-3 means? One run has been made and the data point is going beyond the 3 standard deviation. Like in this is the main value and the the run of the value of run is coming out beyond the 3 standard deviation. So it is violated when the IQAC value exceeds the mean by 3 standard deviation and the AC run is regarded as out of control and it is sensitive to some random error. So out of control should be rejected. Then fourth rule is 4-1s rule, means 4 consecutive runs have been made. So it is violated if the 4 consecutive IQC values exceed the same limit. all four are going beyond the normal range and within the same limit, they may indicate the need to perform the instrument maintenance or reagent. So it is sensitive to some systematic error. This is the rule number 4 SD. It is only applied when the IQAC is tested in duplicate, and this rule violates the when the difference in SD between the duplicates exceeds the 4SD. So it is rejected, 2 plus and 2 minus. So 2 consecutive run here, 2 here. So like the total difference between the two is of 4 standard deviation. So it is sensitive to some random error. Similarly, there are various rules. So if the QC is out of control, so we should stop testing, identify and correct the problem, and repeat testing on the patient sample and control, and do not repeat the patient results until the problem is solved. So let's see what is the external quality assurance program or external quality control program. So it is a system for objectively checking the laboratory performance using the external agencies. There are certain accreditation agencies present in India and abroad. So it is important for improvement and measure of laboratory performance. It is similar to the exam happening in a medical college, a few internal exams and few external exams. So the question paper comes from the university, from outside the medical college. So the same way, the external agencies regularly send the external quality assurance samples to the laboratory for their testing, for their data output. So the concerned laboratory analyze the result and returns the results to the agencies. They evaluate and compare with the actual value, and they then prepare a report of external quality assurance performance. And then if the report is well and good, or if there is a no some it needs some improvement, so corrective actions are instructed to be taken by the laboratory. So this is about the external quality control program. So what is the key message from all this quality control program? So a quality control program allows the laboratory to differentiate between the normal variations and the errors. The QC program monitors the accuracy and precision of the laboratory assays. The results of the patient testing should never be released if the quality control results for the test run do not meet the laboratory target values. Thank you.